Is your dog limping? Like humans, dogs can get injuries or develop illnesses that lead to limping. Lameness or limping means the dog is walking abnormally on one or more limbs. This may be due to pain, loss of function, or both. In some cases, the dog can put weight on all limbs but a limp or abnormal gait is observed. Before we move on with this video, you need to grab the free Dog Training Secrets Guide in which I have disclosed the deepest dog training secrets that professional dog trainers don't want you to know about. These training secrets would help you have a well-behaved, super intelligent, smart and obedient dog without spending hours in training him/her. Link to the free, secret training technique guide is in the description below. ! Limping in dogs is common but not normal. Lameness of any kind is a sign there is an illness or injury. If your dog is limping, it's important to take action. How fast to act depends on the severity of the lameness. Is limping an emergency? Limping is not usually an emergency situation. In many cases, a limping dog should be seen by a veterinarian soon but not immediately. If you notice your dog limping, first assess the situation. Is your dog able to stand or walk? Is there bleeding or swelling? Do you need to administer first aid of some kind? How painful is your dog? Are there other signs of illness? There are some situations in which you should bring your dog to the nearest open veterinarian immediately. If it happens after hours, you may need to go to an emergency vet clinic. Watch for these signs: sudden inability or unwillingness to get up or move, extreme pain, trembling, vocalizing and/or showing signs of fear or aggression, bleeding profusely, apply pressure to the wound on the way to the vet, excessive swelling in one or more limbs, obvious fracture, broken bone. If you notice anything else that makes you worried, you should contact a veterinary office for advice or simply get to the vet's office. It's always better to exercise caution when it comes to your dog's health. How to move an injured dog. Be very careful when moving an injured dog, as you could accidentally make his injuries worse or cause unnecessary pain. A painful dog may bite out of self-protection, even if he has never bitten anyone before. Carefully lift your dog into the car, even if he is able to walk on his own. If your dog is unable to walk, it's best to find help carrying him to the car, unless he is very small. If possible, slide a sheet or blanket under your dog followed by a board or cardboard box to act as a stretcher. With the help of another person, slowly move your dog to the car and secure him in place if possible. If you are concerned about moving your dog or need help finding the best way to move him, call a veterinary office for advice. What to do if your dog is limping. If you notice your dog is limping, but have determined it is not an emergency, there are a few things you can do to help. First, examine the area. If your dog will allow it, try to get a closer look at the affected limb. Is there a certain spot your dog is licking? This could be the source of the problem. Gently handle the foot and leg, looking for cuts, bruises, swelling, heat, tender spots, instability, and any other unusual signs. Look at the paw pad and between the toes to see if there is a wound or a foreign object stuck somewhere. Check for torn toenails. Gently manipulate the joints to check for tenderness or stiffness. You may feel or hear grinding in the joints that might indicate arthritis. If you find a minor wound, clean it with gentle soap and lukewarm water, no hydrogen peroxide or alcohol. You can apply an antiseptic ointment if desired, but make sure to keep your dog from licking it off. Major wounds should be handled by a vet as soon as possible. If you cannot tell how deep the cut is, you should get to the vet soon for closer examination. For minor swelling, you can apply ice wrapped in a cloth for 10 to 15 minutes if your dog will tolerate it. If the swelling continues after 12 to 24 hours, go to the vet. If your dog has a small object in his paw, like a tiny splinter or piece of glass, you can try to dislodge it with tweezers, but be very careful. Your dog might bite out of pain and you don't want to get hurt too. If you are able to pull out the item, clean it afterward as you would for a small cut. If you cannot remove the item or are uncomfortable trying, go to the vet for help. Rest and confinement are best for healing. In many cases of limping, there will be no external signs. If this is the case for your dog and the limping is not severe, try to keep him quiet and comfortable. Encourage your dog to rest and do not take him for a walk or run. Do not allow your dog to exercise or jump up. Avoid stairs or carry him up and down the steps. For potty breaks, take your dog out on a short leash just to do his business. At all other times, crate rest is the best plan, especially if you won't be home for part of the day. Alternatively, you may confine your dog to a very small area. Provide a soft bed that is low to the ground. If the limping does not begin to improve within 24 to 48 hours, bring your dog to the vet for an examination. Warning: never give your dog over-the-counter medications unless specifically recommended by your veterinarian. Ibuprofen, acetaminophen, and naproxen are toxic to dogs. Contact your veterinarian before giving any medications. Causes of limping in dogs. Dog limping is caused by either an injury or an illness. Limping often indicates that your dog is in some kind of discomfort. However, it may also mean that your dog is physically incapable of moving normally whether or not he is in pain. There are a variety of reasons for limping in dogs. Sprain or strain: one cut on paw or foot, object stuck in paw or foot, torn nail bite from an animal or insect, arthritis, fracture, broken bone, dislocation, luxation, or subluxation of a joint, torn ligament or tendon, congenital malformation, other muscle, nerve, bone, or immune system disorder. In some cases, the actual cause of limping cannot be determined. Your veterinarian will talk to you about options for diagnosis and treatment of your dog's limping. Veterinary care for dog limping. When you bring your dog to the veterinarian for limping, the staff will begin by getting some information from you. They will ask how long the limping has been going on and whether or not you saw the original injury. They will ask other questions about your dog's medical history. Provide as much information as you can about your dog's limping and medical history. If the limping is intermittent or there is another abnormal aspect to the gait, you may wish to take a video to show the vet. Next, the veterinarian will conduct a physical examination. The vet will check over your dog's entire body looking for potential causes of the lameness and concurrent health issues. Your vet may also recommend lab testing to assess organ function and blood cell counts. Lab work is useful for several reasons. They may reveal or rule out health problems that cause or contribute to the lameness. Or, there may be underlying problems that are unrelated to the limping but will make sedation or medications dangerous. Some owners think lab work is unnecessary and expensive. Do you want to have a well-behaved, obedient and calm pet dog without spending hours in training him? Check out the first link in the description and download the Secret Training Technique guide absolutely free. It is available for free only for a limited period of time. Thanks for watching the video. Comment below if you liked the video. Please subscribe to the Little Paws Training channel if you are serious about training and grooming your dog. Also, join our Facebook group where you get all the solutions to your daily doggy problems.